welcome back to Simply Women's Health with CJ. Today we're going to talk about bacterial vaginosis, or BV. BV is actually the most common reason that women seek medical care in the gynecological setting. It is very, very common. 84% of women over their lifetime will have a bacterial vaginitis infection. BV is not a sexually transmitted infection. However, it is related to sexual activity. So for people who have never had sex, they have a very low likelihood of ever having bacterial vaginitis. The normal vaginal flora. So what is normal? We all have some bacteria. We all have some yeast that lives in our vagina. We also have what are called lactobacilli. The lactobacilli are the good guys that keep everybody in check, and lactobacilli really depend on a steady pH to keep the vagina at a healthy state. When you have events that can upset the pH balance, such as when you have sex, semen actually has a different pH than the vagina, so that can throw off the pH balance in your vagina. If you're using an intrauterine device, one of the ways the IUD works is it changes the pH of your cervical mucus, making it hostile to sperm. So some people will have more vaginal infections when they have an intrauterine device. If you are pregnant, again, those hormones can throw off your pH balance, and some women will have more vaginitis during pregnancy. If you are douching, that too can cause you to have more vaginitis, more bacterial vaginitis. So how do you know you have BV? Your discharge becomes grayish white, often has a very distinct fishy odor to it. You may have burning when you urinate. You may have a little bit of discomfort or irritation. BV doesn't typically have a lot of vaginal irritation, but some women will report some discomfort down there. So you believe you have BV, you make an appointment with your provider, you're going to come in, your provider is going to want to get a good thorough history. What are your symptoms? How long have you been having them? Are you sexually active? Do you have a new partner? Does your partner have a new partner? Because foul-smelling vaginal discharge also occurs in some sexually transmitted infections. So they are going to want to get a good, thorough sexual history as well. Have you used any over-the-counter products to try to get rid of your symptoms? After they get your history, they're going to want to do an exam. Again, they're going to want to put the speculum into your vagina. They're going to want to open it up. They're going to want to take a swab and go in and gather some of the vaginal discharge. They may also, again, do an STD screen while they're in there. After they get their results back, your provider will provide some form of treatment if it is determined that you have bacterial vaginitis. The treatment can either be a pill that you take every day for 7 days, and I do recommend you take all the medication as prescribed. They may do a vaginal gel that it will come in a tube. You put this tube up into your vagina. You put the medication in there, and you leave it in there overnight. That medication you use for 5 days as opposed to 7. Again, if they give you the pill, please take all of it as prescribed. So what are things you can do to try to prevent bacterial vaginitis? First of all, do not douche. Remember, when your discharge is trying to leave your body, discharge has bacteria in it, it has dead cells, it has all those things, because the vagina is essentially a self-cleaning oven. It's trying to take care of its own self, which is why I usually tell my patients, leave her alone. If you are douching, you are taking fluid and you are pushing bacteria back up into your vagina that was trying to leave. That bacteria can now get up into your tubes and lead to an infection later on down the road that can actually make you pretty darn sick. Limit your sex partners. If you are sexually active with one partner, condom use can help with that. If you are in a same-sex relationship, bacterial vaginosis can be passed back and forth between partners. So make sure that if you have any sexual devices that you're using, that you clean them very thoroughly. I usually recommend putting those in the dishwasher. Cotton underpants. Cotton is wicking and will pull that bacteria away from the vagina, or no undies at all. Just keep her open to air as much as possible. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.